An appropriate warm-up should precede every exercise session. Warm-up routines should begin with a low-intensity whole-body activity such as jogging. This will increase heart rate and blood flow to the muscles, thereby preparing the athlete for the higher intensity workout to come. This general warm-up should be followed by a specific warm-up that consists of some of the session's exercises at a low intensity. Male and female athletes have similar muscle structure, which allows them to follow the same training program. However, there are some differences between the genders. Male athletes have greater absolute strength and can therefore produce more power. This power contributes to the utilization of the stretch shortening cycle and enhances performance of speed, agility, and quickness drills. Decreased power production and increased risk of injury in female athletes is most often explained by neurological factors. When designing a program, however, gender is not a major factor. Rather, the focus should be on training age, the sport, and the athlete's ability. Performance of female athletes can be affected by the female athlete triad. Low energy may be associated with eating disorders, menstrual disturbances, and low bone mineral density. Prevalence of the triad is common among females who participate in sports where lean body mass is critical. It is important to be aware of the seriousness of these disorders and to recognize their signs and symptoms. An adolescent athlete should follow a periodized program, similar to ones for adult males and females. A needs assessment is critical, as it will identify whether the adolescent athlete has mastered basic movement patterns. It is imperative to develop a strong foundation of motor skills before progressing through a training program to more intense and sport-specific exercises. A periodized program should be based on the needs and limitations of the athlete and not chronological age. Injury prevention is a major part of any training program. It is vital that every athlete advance in a progressive and systematic manner when embarking on speed, agility, and quickness training. A properly conducted strength training program that emphasizes knee, hip, back, and ankle strength will reduce the possibility of injury when speed, agility, and quickness training is first introduced. Training should progress from simple to complex movements, from low to high intensity, and from general to sport-specific motor patterns. Moreover, factors such as frequency, intensity, volume, body structure, sport specificity, training age, and periodization phase should always be considered when designing speed, agility, and quickness training. Here are a few more recommendations for athletes to help prevent injuries. Follow the proper progression of exercises, and wear proper clothing and shoes. Observe safety procedures while learning and mastering the speed, agility, and quickness drills in this book. Make certain all equipment is in proper working order before use. If exercising outdoors, make sure the area is free of any hazardous objects, such as rocks or trees. Be sure to understand each new exercise completely before attempting it for the first time. When athletes first attempt a new exercise, they commonly experience muscle soreness. This soreness, called delayed onset muscle soreness, or DOMS, usually occurs 24 hours after the exercise bout, peaking between 48 and 72 hours. The eccentric portion of the exercise is the primary cause of DOMS, and the prevailing explanation is micromuscle tears. The only way to reduce the development of DOMS is to adapt to the exercise stress. This requires repeating exercise bouts over several weeks, with sufficient rest between sessions. Since all speed, agility, and quickness training involves eccentric exercise utilizing the SSE, it is recommended that novice athletes perform no more than 2 exercise sessions per week separated by 2 or 3 days. Experienced and advanced athletes may exercise 3 or 4 days per week, depending on their training phase. In summary, speed, agility, and quickness training is high-intensity work that requires a foundation of strength. It may result in mild muscle soreness until the athlete adapts to the prescribed exercises. Regardless of gender and age, these exercises should be introduced slowly, before progressing to drills of higher intensity and greater complexity. In the coming videos, we describe the drills that make up speed, agility, and quickness training and show how to integrate them into a complete training plan.